Naomi Lawrence, and I'm talking to Conroy Chow about his article, Performance Measures in Dermatologic Surgery, a review of the literature and future directions. I guess the first question I have for you is, why are you interested in this? How did you get interested in performance measures? And why is this something that you think is really important for our specialty to be focused on?
When I was in training, one of the things I noticed in reviewing a lot of the literature, trying to answer my questions, is that there isn't a lot of research to answer a lot of our questions. One example is the use of prophylactic antibiotics in dermatologic surgery. And so that actually prompted me to look further into the literature to see what things do we do in the field have evidence bases and what don't. What is based on tradition, what is actually based on current research. And so that actually triggered a lot more questions and more delving into the literature that looked for more answers. And this actually opened a can of worms, and that prompted me to write this paper in collaboration with our team in the American College of Mohs Surgery regarding performance measurement.
So I'm sure you know that a lot of physicians are very concerned about performance measurement. We're concerned that it, in some measure, could be used to regulate or to punish us or to affect reimbursement. So make us feel better about that.
Yeah, I think you raised a really good concern, Naomi, in terms of punishment. I don't think the point for the performance to have these, let's start that one again. I think you raise a really good concern, Naomi, in terms of people's fears and concerns about having performance measures and things that are reported to registries. From my perspective, I think performance measures will actually improve care, and that's been shown in many other specialties. We're one of the specialties that don't currently have a qualified clinical data registry. And I think it's important for us to define what is important for us in terms of value and what's important to us in terms of good quality care in dermatologic surgery. And we should define those because we're the ones who are taking care of our patients, and we know what's important. A lot of the others, if we don't do so, I think people who are external to dermatologic surgery and Mohs micrographic surgery will define it for us, and that can actually lead to bigger issues down the line. So from my perspective, having us define it, we know what's important, we know what's valuable, and that will help us actually define care. And I think it will also show to insurance companies and reimbursement agencies why we're providing value quality care to our patients.
What do you think is the most feasible option for reporting surgical outcomes in the near future? Is you mentioned the college registry, is that ready for widespread use?
Yeah, that's a wonderful question. So we have the AAD data derm, which was introduced a few years ago, but the only issue with that is it doesn't relate a lot to dermatologic surgery. So the American College of Mohs Surgery registry, Mosaic, was designed for the sole purpose of helping us in the field of Mohs surgery define what is important to us for quality. What metrics are important to us?
I would think that being cancer surgeons, that one of the most important metrics would be establishing a 5-year recurrence data. Is that something that you think we can accomplish with the registry?
In the pilot data that was done originally, we had a lot of issues with the 5-year recurrence data. And the reason behind that is there were a lot of patients who were lost to follow-up. I do think it's important. I think we as Mohs surgeons feel that 5-year recurrence and defining that as a quality metric is valuable. And I think there are a few ways we can approach that. One possibility is to make that part of our standard of care, making sure our patients follow up with us regularly, annually, every 6 months, indefinitely, so that we know we can actually report the data that this patient did not have a recurrence. Another possibility in a more controlled manner would be to do a longitudinal study to follow patients for 5 years, but at least in the pilot data, there were some limitations because patients were lost to follow-up. Now, the development of this registry, this mosaic registry in the American College of Mohs Surgery, is an iterative process. So there will, with collection of data, we'll have to see what things can be refined and what needs to be refined and how we can address changing needs and changing times in terms of concerns or questions that may arise. But by collecting the data, only then can we proceed with analyzing what we have to kind of further define and refine quality metrics in the field.
I don't know if you're aware of this, but there was recently a task force between facial plastics, and dermatology that came up with some performance measures for Mohs post-reconstruction. How important do you think it is that we not only collect our own data, but we somehow interface with other specialties who do similar types of procedures?
I think it's great that other specialties are defining quality measures as well. But one thing to keep in mind is that this is an iterative process. So we have to collect data and see how well those metrics actually report what we want to see. If the metric is not well defined, it can potentially hurt the specialty because it can potentially lead to additional scrutiny. So the whole idea for developing these metrics is to collect data and then assess what the data shows so that we can give ourselves feedback and make ourselves better in the field.
So I have to say, I love the interpretation you have. I feel a bit more positively about metrics when the idea behind it is how can we be better, and the only way we can be better is to look at data. But part of what we do to provide care is we're only a piece of the puzzle. So my question to you is, would there be a way for us to also collect data, or at least make a consideration on how we can look at the whole piece of the healthcare the whole piece of the healthcare system and how that impacts patient care? For instance, pre-certs. Some insurance companies take 3 weeks. Some insurance companies take a day. This impacts the way we take care of patients. It frustrates patients. I'm kind of thinking we should be creating metrics for insurance companies on how they can improve the way we interact with patients and not put obstacles. Is that something you think will ever happen?
Yeah, I think you raised a really good point with that question, Naomi. We're all facing challenges with insurance pre-certification and approval to get certain procedures for our patients, which we think is in their best interest. I think we're right now as a specialty poised to help define what is important to us. And as you know, there are a lot of players involved in the whole health insurance, medical care realm. There's not only the physician side, but there's also healthcare payers, there's patients, there are government entities. And so when there aren't clearly defined metrics for quality and what's important, or if the metrics come from people who are not familiar with our specialty, those can actually hurt us. And right now, for example, I think you bring up the point about insurance companies just making decisions without having knowledge of that. And that sometimes happens where you have somebody who is not familiar with the field or even the medical procedure that we recommend to the patient, deny a procedure just because they think it's too costly. And I think that from our perspective, by defining what is value and showing various facets of why what we're doing is valuable to patient care and it's value driven, I think only in doing so that will help streamline things for us in the future. But this is a process that will take time to define and help and refine.
So I just want to thank you for doing this paper. I think it's really important work. I want to say that you've definitely convinced me that this is an area that we want to drive the information, and we want to make sure that it's information that we collect that is actually going to improve our patients' health and not things that are essentially meaningless. So again, I want to thank you for the paper and your good work.
Thank you, Naomi.